The world has changed a lot since 1978, when the Alma Ata Declaration launched primary healthcare as a holistic approach to the world's health problems. The target was universal health for all by the year 2000. Some say Alma Ata never fully delivered on its promise. Others say these days primary healthcare is more relevant than ever.
We believe that primary healthcare is not only the way forward for Africa, but it's the way forward even for the whole world.
This report shows some ways in which primary healthcare is being used to meet the challenges of the 21st century. Ethiopia is on the move. 2007 marked the new millennium in the Ethiopian calendar, and hopes and expectations are high. The economy's growing fast, and young people are coming to the cities in the hope of finding work. But Ethiopia is a poor country with major health problems, including mother and child mortality rates amongst the highest in the world. A huge effort is underway to meet the Millennium Development Goals, and that means fast-tracking improvements to the nation's health.
The philosophy of the health extension program is if we can provide the right skill and knowledge to the communities, then they can produce their own health. It's just as simple as that.
Vaccination, there is syringe is needed.
In just a few years, the program is training 30,000 women as health extension workers. They'll deliver immunisation, family planning, nutrition advice and other targeted services to all of rural Ethiopia by 2009.
We need to really scale up very aggressively. There is a huge government commitment and there is a huge support and acceptance by our partners, also the donor community.
80% of Ethiopia's people live in rural villages, often isolated from medical services. The aim is for a health post in every Kabali, a sub-district of around 5,000 people. It's a development on previous primary healthcare experiences.
Before we started the health extension program, there was a very candid evaluation that was done on the past performance. The two important lessons were lack of ownership by the community itself, and there were no formal institutions that were leading these primary health care goals. So we addressed these two major problems.
Each health post is staffed by 2 full-time workers. They spend 75% of their time doing prevention and health promotion.
ወደ ቤት ለቤት ሲሄድ በመጀመሪያ ደረጃ የህብረተሰቡን ችግር ምን እንደሆነ ለማወቅና ለዛ ለተፈጠረው ችግር እዛው ቤት ውስጥ ሆኜ መፍትሄ ለመፈለግ ስለሚያመቸኝ
Model families are trained to help spread good practice, and mother and child health is the priority.
In our primary health care, health extension program is the front line, the first line. And we have health center expansion services as a second line, which focuses more on basic and comprehensive obstetric care.
ህብረተሰቡ የራሱን ጤና እንዲጠብቅ ያ ሁሉም ነገር በራሳቸው እጅ ያለና ከግንዛቤ እጥረት የማይጠቀሙ መሆኑን እኔ ስመጣ ከዚህ በፊት ብዙ ችግሮች ነበሩ። የሰዎች የራሳቸው መጸዳጃ ቤት የላቸውም፣ የሚጠጡትን ውሃ በንጽህና አይዙም፣ አካባቢያቸውን አያጸዱም፣ ቤታቸው የተናፈሰ እንዲሆን አያደርጉም እና ያ ሁሉ ችግር አሁን በአሁኑ ሰዓት ተቀርፎ ነው ያለው።
The health post delivers selected treatment. Here this woman is being tested for malaria, one of the program targets. But the focus is on prevention rather than cure and facilitating community action. Targeted issues like HIV/AIDS are discussed in community conversations and plans decided. The result is a drop in all major infections.
We are seeing really encouraging results in areas where we have already deployed. These 30,000 health extension workers will reduce the major mortalities significantly, because each and every individual you're assuming is taking the responsibility, and that will be a shortcut to make a huge impact that we're looking for.
The 1994 genocide decimated Rwanda's fragile economy base, destroyed a large share of country's human capital, and eroded the country's ability to attract private sector investment. Child and maternal mortality increased during and after the genocide, but now is decreasing significantly. The main source of success for the boost of the primary healthcare services in Rwanda was the implementation and a rapid scaling up of innovative policies such as performance-based contracting and the micro-health insurance scheme. Immaculée Mujawamaria lives in Gahanga sector in the rural neighborhood of Kigali. She is 44 years old and head of a family of 5 children since her husband was arrested because of his participation in the 1994 genocide. As 80% of Rwanda's population, Mujawamaria's occupation is agriculture, and she earned no more than $1 per day. Isabiriza Francine, a 20-year-old girl, is the second daughter of Mujawamaria. She got pregnant while living with her mother. Her partner refused neither to marry her nor to bear the cost of the pregnancy. Mujawamaria, as many Rwanda's women, was the one to take care of her daughter's pregnancy.
Mugejeje kwa muganga baramusuzuma baramubabyaza nta kibazo. Amaze kumubyaza ubwo nkagira ubwoba ntise amafaranga bazanca nzakura ko ndi umukene. Ubwo ngubwo amaze kubyara tugeze igihe cyo gusezera kujya gutaha bahabanyitse amafaranga 200 yonyine nduva ndishimye we nari ko wenda banca nk'ibihumbi 20 cyangwa 15 ariko byabaye 200.
Umwana hashize icyumweru bona tarambura amaguru. Ngezeyo rero baramusuzuma bahita bamarandevu bahita bamatarasifere yo kujya Kanombe. Ngeze Kanombe naho bahita bamatarasifere yo kujya CH.
Gahanga Health Center is one of the health facilities which successfully implement the scaling up of community insurance scheme. This boosted the use of primary healthcare services among the population living in the catchment area of the health center, approximately 20,000 people. The insurance covers the cost of services at the health center, and in case of transfer at the district hospital and the referral hospital.
Ariko noneho bamaze kumubaga bamukuyemo icyo kintu cyari kimurimo umwana yabaye umwana ahubwo ngiye kumubaga kwe nabonaga rwose pe ko nimuka intanga ntazongera no kuhagaruka kubera amafaranga nzatangaye ariko noneho mituwe ningira kamaro rwose ngiye ko mbibona.
Cambodia, a nation famous for its ancient civilization, but also its recent tumultuous history, is now looking toward a peaceful and sustainable future. Economic growth over the past decade has been around 8% a year, but the benefits of the economic boom are yet to be shared equitably. Cambodia's health system was completely destroyed by the Khmer Rouge. In places where health centres existed, there were no staff, equipment or patients. People had no trust in the health system.
In 1999, the Ministry of Health first contracted NGO to help to manage government health services in 5 remote districts. These were expanded to 11 districts in 2004, supported by the World Bank and Asian Development Bank.
Non-government organisations were contracted to help the weak government health system in remote areas to reach key primary health care performance objectives, be it good immunisation coverage or antenatal care. In remote Prévihir, a province of 150,000 people, Health Unlimited was contracted to help to run primary health care. The Ministry of Health seconded 215 government staff, 12 health centres, 13 health posts and 1 referral hospital.
The contracting has improved staff motivation through salary incentive. The staff are happier and work full-time.
Staff also visit the community to provide immunisations, antenatal care and iron tablets. Cambodia is also known for its use of equity funds to help the poor access health services. Equity funds pay user fees on behalf of the poor and also the cost of transportation and food. Equity funds, usually managed by non-governmental organisations, also monitor the quality of care.
The 2005 Cambodian Demographic Health Survey showed that the health service have improved and were more successful. I see that contracting is very successful in delivering health services to population.
The new health strategy proposes to scale up contracting principles within the government to further improve health system performance, including independent monitoring and evaluation. The government also plans to scale up equity funds to reach more of the poor.
On the streets of Bangkok, primary healthcare may not seem much in evidence, but it was government policy for years in the 80s and has had a long-lasting impact. Almost 800,000 village health volunteers are trained as the front line against disease, and community action has proved instrumental in turning around a number of health threats, including HIV/AIDS. Now its supporters believe the primary healthcare strategy can be adapted to fight new health problems.
In the old days, when primary healthcare was started, we are busy dealing with infectious diseases and some of the so-called diseases of the poverty. But Thailand has moved a long way after 30 years. They are now trying to make sure that the primary healthcare concept could also address the so-called new threat of health system, which is chronic diseases.
The gym at Sao Hai Hospital is part of the new primary healthcare front line. Trying to stem a rise in chronic diseases, the hospital runs workshops in healthy lifestyles and takes a holistic approach to its role.
ก็คือในวิสัยทัศน์เราเนี่ยจะมุ่งสู่สุขภาวะชนซึ่งเราก็อยากจะให้สุขภาพดีนั้นเราต้องทำเรื่องเกี่ยวกับ primary health care ให้ต่อเนื่องนะครับแล้วก็ให้มันยั่งยืนนะครับ
Appropriate treatment is one area of focus. Traditional massage sits alongside normal hospital procedures, and acupuncture is used for conditions where standard medical treatment has proved ineffective.
ในเรื่องของทางด้านร่างกายนะครับคนไข้นะครับก็มีการหายของโรคเร็วขึ้นภาวะแทรกซ้อนจากการรักษาเนี่ยน้อยลงนะครับการส่งต่อคนไข้น้อยลง
Another focus is to reach out to different sectors of society, from community volunteers helping patients to Buddhist monks visiting once a week.
ในชีวิตประจำวันของคนไทยทั่วไปเนี่ยก็มีการตักบาตรตอนเช้าอยู่แล้วถ้าเกิดเรานำพระเข้ามาในโรงพยาบาลเนี่ยเป็นการให้การดูแลด้านจิตใจหรือว่าด้านจิตวิญญาณนะครับ
Community action, however, remains the key. The hospital promotion teams visit nearby villages every week, working with patients and their families and encouraging local initiatives.
ก็มาเอาตัวเลขตัวนั้นมาเล่าให้ชุมชนฟังชุมชนเขาก็ตกใจเหมือนกันว่าชุมชนเราถ้าเกิดปล่อยเป็นอย่างนี้ไปเรื่อยๆเนี่ยก็มีแต่ต้องเสียค่าใช้จ่ายเรื่องการรักษาเนี่ยมากขึ้นในกลับมาทำงานในเรื่องส่งเสริมสุขภาพกับป้องกันโรคเนี่ยมากขึ้น
Community participation is important not only to influence the awareness or the knowledge of the people who are sick, but to make sure that the community environment is actually trying to induce the better understanding. It's a social movement, it's a community movement.
At a national level, initiatives like those in Sao Hai are supported by a 2% tax on alcohol and cigarette sales, funnelled into the Thai Health Promotion Foundation. Its strategy is to create practical ways to encourage community action on current issues.
Thai Health is a new approach to primary health care, and what we aim to do is to strengthen the Thai civil society. That's the principle, to empower the people and allow them to look after themselves. But the principle needs a practical delivery.
Back at Sao Hai Hospital, the staff know their aim is to keep drug bills down and the patient numbers as low as they can, and they believe they know how to do it.
ผมว่าประเทศไทยโชคดีที่เรามีพระมหากษัตริย์นะครับซึ่งท่านได้บอกแนวทางแก้ไขปัญหาทุกปัญหารวมถึงปัญหาสุขภาพแล้วก็ในหลวงสอนเราว่าให้เรานั้นได้พึ่งตนเองไม่ว่าจะเป็นการออกกำลังกายหรือว่าเราใช้สิ่งที่มีอยู่ในประเทศเราทรัพยากรที่มีในประเทศเราจะแก้ปัญหาสุขภาพของเราได้โดยที่ไม่ใช่ความฝันแต่เป็นความจริง
This report has shown a few ways primary healthcare is responding to current issues. The health environment is changing, with globalisation, free trade and mass tourism bringing new disease patterns, intellectual property issues and a widening disparity between people around the world. Those who believe in the power of primary healthcare know it needs to continually adapt to meet the new challenges ahead.